What exactly is adult ADHD and how is it diagnosed and dealt with? In this podcast, I will explain the three core symptoms, the causes, and the different treatment options for patients with adult ADHD. I will also explain how adult ADHD is diagnosed through a 9-symptom rating scale of the different symptoms and how patients choose to deal with the diagnosis of adult ADHD. Three core symptoms of adult ADHD are impulsivity, hyperactivity, and distractibility. Impulsivity is shown through the inability of those diagnosed with ADHD to be able to control their words and actions. They will often say or do things that appear to be the result of raw emotion and are unfiltered by common logic and the idea of social conventions. Hyperactivity is shown through fidgeting, unending talking, and the ability of an individual to remain silent or still for long periods of time. The final core symptom, distractibility, is a component of both hyperactivity and impulsivity. There has not yet been a conclusive cause of ADHD. However, a lot of research has been done on the topic, and the research indicates that the cause of ADHD is a combination of many factors. Some of these factors are the genetic component and brain structure and function. Adults who have ADHD generally have at least one close biological relative that also has ADHD. There are a number of brain-related factors, such as structural abnormalities, supplies of dopamine, norepinephrine, and some functional differences between those who do and do not have ADHD. Many people choose to take medication to treat their ADHD symptoms. Some commonly prescribed medications are Adderall, Catapres, Cylert, Dexedrine, Dexostrat, and Ritalin. In an attempt to diagnose ADHD in adult patients, Professor Emeritus of Psychiatry and Behavioral Studies at Duke University's Medical Center established a rating scale of the following 9 symptom domains: inability and concentration, hyperactivity and restlessness, impulsivity and self-control, executive function, memory, difficulties with self-image, interpersonal problems, learning problems, and mood disturbances. Everyone deals with the possibility of adult ADHD in different ways. Some seek more education on the subject, and others seek medical help. Some of the most common ways of dealing with the possibility of adult ADHD are getting evaluated by a medical professional who can effectively diagnose if you have adult ADHD, medications such as Ritalin or Adderall, education about adult ADHD from reliable sources such as medical journals, medical professionals, or medical websites, organizations such as getting desk calendars, personal digital assistants, and regular daily routines. Another way of dealing with the possibility of adult ADHD is counseling